Great, thank you, Susan. So before the break, we have a patient presentation from Michael Lax.
Thank you very much. I want to first of all thank the foundation for inviting me to speak. Thank you, Stacy. I appreciate it. I'm honored. I also want to thank all of those in the medical community. I'm just overwhelmed by the passion and the energy and just the drive that everyone here is showing to try to find a cure and to find better outcomes. I'm humbled as a patient that you do that on our behalf, on my behalf, on behalf of all the patients and their families. So I just wanted to start by saying thank you. So first, a little bit of background about me. My name again is Michael Lax. I'm 56 years old. I am married and I have 4 kids. I've generally been active most of my life, generally been healthy. I've been conscious of what I eat. My family has no history whatsoever of cancer. I never thought about cancer at all. And I was diagnosed when I was 54 years old 2 years ago. And my health coverage was provided by an HMO, a large HMO in Northern California with a very good reputation. So that's a little bit of background about me. How do you make this go forward? Oh. There we go. So this is my timeline. I'm not going to go into all the details, but a spoiler alert, I am cancer-free as of last year, January. Thank you very much. Really, the thank yous go to my doctors, who I'll point out in a few minutes. They're wonderful doctors. I really have 3 messages today. And I'm going to tell you a little bit about my story, and as I go through them, I'll point out those messages. Oops. Well, again, spoiler alert. I didn't mean to do that. But my story really begins in December 2013 when I first became symptomatic. By January of 2014, I was in the hospital and spent pretty much from January to April of 2014 in and out of the hospital many times. Had roughly a dozen ERCPs in that time frame, MRCP, spyglass, ERCP, whatever they call. Obviously, all of the scans and MRIs that are associated with this, trying to locate an image. I also had a stroke. Yes, I had a stroke. And I had emergency surgery to stem internal bleeding resulting from one of the ERCPs. So it was a real mess. Finally, in May of 2014, the doctors decided to do exploratory surgery. And at that time, they did that. And I was diagnosed with perihilar cholangiocarcinoma. I believe it was stage 3B, non-resectable. That's what I was told, non-resectable. So at this point, it's been about 5 months. I don't know if my doctors did a good job or a bad job. I have no idea. I'm sure they did the best that they could. But what I do know is it took 5 months. And I can't help but think that that was a long time. And that didn't seem to really hurt me in the end. But it might have been precious time for someone else. And some of the patient stories that I've heard over the last couple of days, I've been impressed by some of the diagnoses happening very quickly and a resection happening very quickly. I heard one story that within 30 days the person was diagnosed and resected. So kudos to the doctors that were able to do that. But my point here is that there needs to be a greater awareness on the part of community hospitals and local physicians. I call them generalists. I hope I didn't offend anybody in the room. I didn't know any other way of calling them, those folks that work in HMOs, for example, that don't necessarily have great specialties in rare cancers. But my experience was that there wasn't an awareness of cholangiocarcinoma or the need to refer patients with cholangiocarcinoma to places or centers of excellence, cancer centers that are listed on the foundation's website as an example. And I think that was critically important. And that kind of leads me to my second point. The Cholangiocarcinoma Foundation helped save my life, and I'm thankful for it. My wife found the Cholangiocarcinoma Foundation, and through the foundation reached out and was referred to Marion Schwartz and Sue Acquisto, who both encouraged us to find a cancer center, a center of excellence in cholangiocarcinoma. And they encouraged us and pushed us, so thank you very much for doing that. The foundation website was critically important to us. The blog or the dialogue blog was a place for us to go and speak to other families that are dealing with cholangiocarcinoma. It was a place for us to get answers to questions. It was a place for us to get advice. So it's important that the foundation know this. Your work is critically important, and thank you very much for doing that. I should mention that my doctors, my initial doctors, they didn't even recommend the website. And that's how much I believe that there needs to be an increase in awareness. So when I was first diagnosed and they told me that I was non-resectable, the surgeon actually told me I had weeks to months to live. That's what he told me, weeks to months. So they transferred me to an oncologist who then, had a palliative approach and told me that he would manage the end of my life. And of course, my wife and I were puzzled by all that. I certainly didn't feel that bad. And we asked, what else can we do? And they said, nothing. Who else can we see? No one. Trials? They don't exist. So we got really no help in that regard. But through the foundation and through the research that we did in terms of the cancer centers, we ended up at UCSF, and we met with the greatest doctors in the world, Dr. Kay Kelly. I don't know where she is. Maybe she's left. But and Dr. Carlos Corvera, the surgeon, and Dr. John Gordon was very instrumental. Thank you very much, John. These are the greatest doctors in the world. No, please don't take offense, all the other doctors. And Dr. Carlos Corvera, Kay Kelly brought my case to the tumor board at UCSF. I didn't even know a tumor board existed, but she did. And Dr. Carlos Corvera said, wait a minute, you are in fact resectable. Your biology of your system's a little different than most people, and I think that you are resectable. And indeed, in January 2015, he performed resection, and I got a clear margin on one side and an almost clear margin on the other side. I followed that up with a short period of SBRT radiation, and I've been deemed cancer-free since. So that kind of brings me to my third point. There is hope. I was given no hope. I was, told that, there was no hope. But indeed, there really was, because we found folks that knew more about cholangiocarcinoma than the generalist that I was referring to before. We were shown a way forward, and like the story yesterday that Candace gave when she was at the end of her road and felt that there was no hope, there is hope. And when I hear what went on today, especially with all of the discussion about genetics and epigenetics and the work around that the grant researchers have talked about, and all of these future technologies and future treatments, most of which went over my head, except I did remember that the zebrafish has liver. So there we go. But I'm so encouraged by what lies on the horizon. Better treatments are nearby. I really believe that. I'm optimistic about that. And I hope that all the patients in the room feel that same way. I'm so grateful for this meeting and the fact that the doctors here would put in so much time and effort, not just here attending the meeting for 3 days, but also everything you do over the course of the year. It's incredibly humbling for a patient like myself to know that you guys are working full-time on this. So I end with the message that there is hope, and keep at it, guys. Thank you.